Hello, my name is Danielle Kirkendall and I'm doing my career portfolio. Here's my elevator talk. Hello, I'm Danielle Kirkendall. It's a pleasure to meet you. I'm a HIM analyst at St. Francis Hospital where I'm passionate about creating personal growth and focusing on my goal to become a HIM director. Currently, I'm earning my bachelor's degree in health information management. In order for me to have a well-diverse HIM background, I am seeking experience as a HIM manager or director. I would love to talk to you more about a potential mentorship with you if that's something you have the time for and would be interested in. So this is my quick little elevator talk that I came up with that I could either get a mentor or, if I wasn't working full time, I could get a volunteer time and just shadow a director. Next slide is my environmental scan. My internal analysis is basically what a HIM director would have to deal with. Like, what kind of stuff do they deal with on a daily basis? They participate in committees to address topics like ICD-10, electronic health record implementation, and process improvement. Other things like budgets, perform employee evaluations, ensure that we are in compliance with state and federal laws, make sure that we're following HIPAA rules, privacy, security, record completions, things like that. The external analysis I did was the competitors, which is within Columbus, Georgia. That's where I live. There's three big hospitals in Columbus. There is St. Francis, that's the one that I am currently working at, Piedmont Hospital, and Houston. St. Francis and Piedmont is both acute care hospitals, and then Houston is an orthopedic center. Political factors, you're dealing with the law, so anything that has to do with HIPAA, high-tech, JCAHO, affordable care. You'll be dealing with policies and procedures, hospital level and department level. Your economic factors is your healthcare technology. So if you are, just like my hospital just bought out a whole new EMR system, so that would be a technological economics factor. Professional education, my hospital pays for CEs and they'll give you so much reimbursement for education. Healthcare financing, so that also has to do with your budgeting for your hospitals and your department budgeting. Your social factors, emphasis on quality, your population growth rate, career attitudes. Your technological factors, your EMR systems, like I said, we just implemented a new one. Information governance, scanners, and computers. A quick career path to HIM director. I highly believe that you should know what your employees are doing, so start from the beginning, your entry level positions. That's where I started as a HIM analyst and also a patient account representative. And then on to your HIM supervisor or release of information supervisor, manager position. And then you can go into medical coding, CDI, your HIM operations manager, your medical coder manager, and then finally to the HIM director. Here's a HIM director position that's opening at Houston Clinic. They want 3 to 5 years experience, and I'm not quite there yet, so I did not apply for this position. My gap analysis for HIM, your requirements, you definitely have to have a technology skills, communication, thinking, management skills. Your education is important, bachelor's and possibly a master's. Your credentials, you have to be credentialed either RHIT or RHIA. My assessment, basically I broke down the skills further and broke it down if I was high at the level or low at the level or moderate. My gap identification, basically I need to have more experience, better communication skills, better time management, and finish my bachelor's. I will move on to my master's after this and get my credential as a RHIA. I am currently a RHIT. My action plan, I'm going to graduate with my bachelor's in 2020, gain management experience, education, so I'm going to continue on with my master's, and then I'm going to get my credentials as a RHIA. My mission statement is to help others live the lives they would if they only knew how. Such a true statement. I definitely believe in that you really need to get your education. A lot of people don't know the process and how to get it, especially when you're older and have children, like myself. I'm a late bloomer in getting my education. My husband's military, so we've moved a lot. So I've decided to go back later in life to finish it. My strength finders, my top 5 was realtor, strategic, responsibility, belief, and ideation. Definitely hit the nail on the head. This is definitely my strengths in general in life. Here's my personal bibliography. Basically, I'm a HIM analyst and I've worked in medical records. I've also been a patient count rep. I started on the bottom. I was successful in that, and I'm slowly moving myself up the career path, and I do hope that I become a health information management director one day. I am a JHEMA member, so I've been to some JHEMA meetings. A lot of it has to do with quality assurance, ICD-10 updates, HCPCS codes, things like that. I have recently interviewed for a release of information position, manager position at ScanStat. It's an outsourced company that works for St. Francis, so I still will be working with St. Francis, just with an outsourced company. And guess what? I am now a release of information manager. So here's my career portfolio. I started from the bottom and I've slowly working my way up to manager role. I hope in the next few years I will be a health information director. Thank you.